Heart disease is even today the number one killer in United States and across the world, and especially in all developing countries. It's one of those things that we have been working at it aggressively, furiously to minimize the number of it.
In the United States, approximately 735,000 people have a heart attack every year. Of those people, 120,000 will die.
And we believe a great number of those can be saved if the right thing happens soon enough. It's important to know the signs and symptoms of a heart attack so that you can recognize the problem and address it immediately.
All heart attacks have a beginning. Approximately 50% of patients who present to the emergency department having a heart attack have had some sort of warning symptom in the 2 weeks preceding the presentation to the ER. Those 2 weeks are an opportunity for these patients to get early cardiac care.
Those symptoms should not be ignored. That's an excellent opportunity to get it caught before real damage sets in.
Having some chest pain, jaw discomfort, heaviness in your chest, left shoulder or right shoulder discomfort, upper extremity heaviness, shortness of breath out of proportion to your daily activities. Another important one is discomfort between the shoulder blades.
It's not always the classic chest pressure. Women often have atypical presentations as well, sometimes just having nausea and vomiting, sweating, shortness of breath.
A strange fatigue that doesn't have any just cause, but they know something is wrong. That's something that should not be ignored.
Atypical presentations can also occur in older patients and patients with diabetes.
Pain in your chest is certainly important, but there are subtle other signs that you should pay attention to, especially fatigue or something that makes you feel dread, something that you know something bad is wrong, but you can't put your finger on it. Call 911.
These symptoms can wax and wane over a time frame, and they can get better with rest and worse with exertion. Sometimes this can cause a patient to think that it's nothing serious and not seek medical care, but that's actually the wrong thing to do. Patients need to get care early to save the heart.
Time is tissue, that's what we call in the world of cardiology.
The damage that happens to the heart muscle happens in the first 2 hours.
Time is critical.
The faster you get an intervention, the more lives we can save.
Let us help you decide. We'll get you to the appropriate care. And if you don't have anything wrong and you go back home, it was a good day. The reason we advocate call 911, survive, don't drive, is that if you try to take a person to the hospital who's having a heart attack, or you yourself try to drive and something goes wrong en route to the hospital, you've ended up with a catastrophe. And what I mean by that is, where are you when that event happens? Are you in the middle of a highway and you crash? Or are you driving someone to the hospital and now you have to call 911 and figure out where you're located, tell the dispatcher where you are, get the person out of the car and potentially start CPR? How do you manage all of that in the middle of a crisis?
Call 911. Survive, don't drive.
The muscle will die in a given period of time, and by taking care of the patient, getting them to the appropriate resources, we can actually stop that muscle death. But once enough time has passed, it's irreversible, and that heart attack is going to be something that they live with, or maybe don't.
Minimizing the amount of time during this first medical contact to the angioplasty will improve the survival chances as well as minimize the tissue loss.
If you call 911, the dispatcher will remain on the phone with you and you get help at that second. They'll tell you what to do and how to care for someone while first responders are coming to your location. They'll get there much more quickly. They'll be able to stabilize the patient if anything goes wrong. And if, God forbid, there is a catastrophic event, they have the equipment to care for the person.
That is extremely important. They can start the initial care of giving you the necessary medications, oxygen if needed, stabilizing your blood pressure, getting an ECG, communicating with the emergency room to see if you're having an actual event like a heart attack.
The emergency room will start a cascade of treatment that brings people into the cath lab to make sure that you are cared for as quickly as possible. When you drive to the hospital without doing that, none of that takes place, and you've delayed the amount of time it's going to take until definitive care can be arranged to resolve that heart attack. If you get it within the first 2 hours, you could potentially totally clear the blockage and leave the heart without serious permanent damage.
Survive, don't drive. This comes as a part of the early heart attack care, or EHAC.
So let's talk about the EHAC oath. EHAC stands for Early Heart Attack Care. And what the oath is a commitment by the community, whereas if someone is having chest pain, whether it's you, a friend, a bystander, you commit to call 911 and activate emergency care.
Please survive, don't drive.
Capitol Health Medical Center Hopewell is an accredited chest pain center as designated by the American College of Cardiology and has been since approximately 2013.
This means that we have standardized protocols to deliver the highest level of efficient care to the chest pain patient.
And this helps us expedite care, standardized care, which is followed throughout the U.S.
When you come to Capitol Health, our team is specially trained to take care of you. It starts with EMS, with a seamless handoff to the emergency department personnel, and all the way through to the cardiac team in the cath lab.
It starts with the recognition of an event from the family member's perspective or the patient's perspective, then alerting the 911 team, bringing them over to the hospital, the emergency room, physician, nurses, everyone being involved in it, and then proceeding, if needed, for an emergency cardiac intervention.
As the medical director of the Chest Pain Center here at Capitol Health, I am extremely proud of our team. We work well together to provide seamless care to the chest pain patient.
Being accredited through the Chest Pain Center and via the American College of Cardiology gives me immense confidence that I'm able to deliver state-of-the-art care.
I'm proud to be part of this team, and I know my peers are as well, because we see wonderful things happen. We see good outcomes. Our goal is to minimize the bad outcomes and try and get people to understand the importance of early care.
Minimizing heart damage or preventing a loss of life is quite possible in this day and age.
During COVID-19, we're following all CDC guidelines to keep you safe while you visit Capitol Health.
As we are going through this pandemic, we have noted across the nation and across the world that there has been a drop in the number of patients coming in with acute heart attacks. This is likely because of the fear of being exposed to COVID. Here at Capitol Health in Hopewell, we have taken all the necessary precautions to make sure that your care and safety is of paramount importance. So please don't hesitate if you're having any signs and symptoms of heart attack to call 911 and get taken care of yourself.